children. Well, we can go live now to Dr. Feroze Sidhwa. He's an American trauma surgeon who has just returned from a month-long medical mission to Gaza, and he's joining us from California now. Dr. Feroze, thanks for being with us here on BBC News. Now, you were there in Gaza as the ceasefire was in place, and then as it broke down, Israel doesn't allow our BBC journalists or any international journalists in. So can you tell us, from what you saw, what is life like now in Gaza?
No, it's a disaster now. This is the second time I was there. I was there about a year ago in March and April of last year, and then I went back for the same period of time this year. And March 18th, when the ceasefire, well, the ceasefire was never really adhered to, but when the really wide-scale bombing of Gaza resumed on March 18th, that was the biggest mass casualty event I've ever seen in my life. Um, Even before that, the border had been closed, hermetically sealed since March 2nd, meaning no goods, no humanitarian aid, nothing had come in since March 2nd. And prices in the market had already gone up. I arrived there on March 6th, and I just kind of watched the price of eggs, for example, in the market go up steadily. When I got there, it was about 50 cents an egg, which is what I pay here in California. But by the time I left, it was almost $2 an egg, which is obviously nobody can afford. There's no clean water. There's very limited access to healthcare. There's no housing available for anybody, for almost anybody, I should say. Almost everybody lives in a home or a room that has one wall missing. Almost everybody, or they live in a tent. It's one of the two. Those are the only real two options. So life in Gaza now is even worse than it was a year ago, which is saying something.
Now, you were working at the Nasser hospital in Khan Yunis. As Israel continues to bomb Gaza, it's saying it's targeting Hamas terrorists. But what are the capabilities of the hospitals and the medical staff there to provide such much needed care?
Yeah, that's right. I was working at Nasser Medical Complex with a group called MedGlobal. That's an American NGO. Actually, the Nasser is interesting because on March 23rd, I had a patient named Ibrahim Barhoum. He was a 16-year-old boy. He was recovering in the men's surgical ward from a bombing attack he had suffered on March 18th when the bombing started again. He was actually killed in his hospital bed on March 8th, or excuse me, on March 23rd when the Israelis bombed Nasser Hospital directly. Nobody claims they didn't. They were quite proud of it, actually. And they said they did it to kill some guy that was in the Hamas political bureau who had been wounded in a bombing attack earlier, destroyed the entire men's surgical ward, killed Ibrahim in his hospital bed. Never had that happen before to a patient. And actually almost killed me because I was on my way down to change his dressings. But thankfully I was pulled into the ICU to help with another patient. Otherwise, I would have been standing right next to him when the bomb exploded. So the hospital, Nasser still has the ability to provide life-saving care, but they're running out of everything. Again, the border has been closed for 33 days now, 34 days. That includes medical supplies. There are no sutures coming in. There's nothing. There's literally nothing coming in. And just to give people an idea of the scale of what's going on, in the Boston Marathon bombing, I happened to be a resident in Boston at Boston Medical Center then. In that one terrorist bombing, the whole city of Boston saw 129 patients. All six level one trauma centers saw 129 patients. Just Nasser, just on March 18th, saw 220, 90 of whom came in dead, and about 40% of whom were badly injured small children. So it's just you're talking about a huge need and just no ability, no hospital in the world could cope with this, let alone hospitals in a besieged enclave that aren't even allowed to be resupplied. It's just impossible.
And I suppose when you add into that the security situation, I mean, the UN has accused Israel of killing 15 rescue workers in Gaza. How does all of that limit what you can do with the limited supplies that are there?
It makes it more difficult to be sure. The security, it's not really that the security situation impacts the supplies, I suppose. But it does make people frightened to come to the hospital. Again, when an entire floor of the hospital is blown up because one guy that Israel doesn't like happens to be there. They don't even accuse him of being a combatant, just some guy that Israel literally doesn't like. Yeah, I mean, that makes people terrified to be in the hospital. It makes doctors terrified to work in the hospital. Again, I literally was on my way down to change this kid's dressings who was blown up in his hospital bed. So it makes me frightened. You know, doctors and hospitals are supposed to be protected places. Patients are supposed to be protected people. Even wounded combatants are supposed to be protected people, but certainly civilian patients in civilian hospitals are supposed to be protected. Um, yeah, it's kind of hard to know what to say anymore.
Okay. Well, Dr. Feroze Sidhwa, an American trauma surgeon who travelled to Gaza with the MedGlobal charity, thank you very much for joining us here on BBC News and telling us what you saw.
Thank you.